Hey everybody, it's your favorite doctor, Dr. Tiffany Butler, and welcome to my YouTube channel. Alright, so I'm going to go over some questions, answer some questions that I get asked while practicing. Alright, so some common questions is, one is, how long is treatment? Well, it's a two-part question. I'm going to give you a two-part answer. The treatment sessions can vary from 10 minutes to 30 minutes, depending on what's going on with your body, depends on what phase of healing you're in. That's generally what it is, alright? The first treatment session or visit usually is the longest because we have to do a history taking, got to figure out what's going on with you, and you paint a picture of what's going on with your body, right? So I'm going to go over your medical history. We'll ask you questions about your injury, how it happened, or what do you think caused the injury? What do you think is causing your pain? And have you done anything in the past? If you have, what worked, what didn't? All right, so it gives me a good idea of a way to approach your situation as an individual and how to possibly treat you. All right, so that's the first session. Usually is the longest. That's almost like an hour, all right, because you got to fill out paperwork, and then we do the exam and all that good stuff. Once you're established as a patient and you come for follow visits or subsequent visits, then the sessions can range anywhere really from like 10 minutes to 30 minutes, again depending on what's going on with your condition, your body. All right, I treat all types of people who've been in car accidents, people who have got hurt on the job, people who fell, people who have sports injuries, people who have chronic pain, people who have acute pain. You know, depends on where you are in your phase of healing. It's what will be done for you during each visit. All right, so it varies again from 10 minutes, it could be 30 minutes. All right, I'm a big fan of exercises, so pretty much everyone exercises in the office. All right, I don't usually give patients sort of go ahead to do it at home. The reason being is when you're under my care and you're doing active treatment, I want to make sure you're doing it right. That's the first thing. And secondly, I want to make sure you're doing them, period, right? Because a lot of patients say, yeah, doc, I'm going to do it. I'm going to do it at home. And they don't. All right, how do I know? Because it's pop quiz time when you come to the office. All right, I'll say, hey, show me the exercise that I showed you last week or the day before. If you can't show it, that means you're not doing them, all right? So everyone gets exercise in the office, so that's add extra 10 plus minutes to your time. All right, adjustment is easy. Adjustment takes less than 5 minutes, all right? The chiropractic stuff, spine adjustment, less than 5 minutes, all right? If I'm doing any type of soft tissue therapy, you can add some more time to that. And if I'm doing any type of modalities, whether heat, stem, ice, myofascial release, passive stretching, anything like that, that just adds more time. So it depends on where you are in your phase of healing. All right, what's going on with your body, that will determine how long your treatment sessions will be each visit, in a sense. And like I said before, the treatment depends on how often you need to come and how long you need to come. All those things depend on what's going on with you, how compliant you are. I've had patients who I recommend treatment plan for. They do what they're supposed to do. They come, show up for appointments. They do their work, and they get better. All right, then have those who just don't follow through, all right, for whatever reason. And reality is this: if you value your health and you've taken the time out of your day to call, to research one, looking for a chiropractor or whatever, and you make an appointment, show up to that appointment, and there's some barriers. Listen, I get it. There's some barriers that a lot of people have, all right? One of the main barriers is affordability. The other one is transportation, all right? Affordability, transportation, all right? And I understand what I do is not cheap, all right? Because I don't give you cheap results, so you have to pay for quality care, all right? And that's unfortunate. Some people can afford it, some people cannot. However, I have to remove myself from that equation of your affordability. You know, I work with pretty much any budget. My goal is to help you to move better, to feel better, and to live better, right? And by doing so, I have to be able to provide the services to you. So if you're not able to make it into the office because you can't afford it, you know, you could do what you have to do to make sure you afford it, all right? We got the holidays coming up, right? People will spend money, take out loans just to buy gifts for people. People go into debt just to buy gifts versus doing something that's going to be good for them, which is taking care of their health. But I digress. All right, so again, to sum up that question, which was how long is treatment? Hopefully I answered it. All right, if you liked the video, give me a thumbs up. Be sure to like, be sure to share, and be sure to subscribe. As always, remember to drink plenty of water, exercise continuously for at least 30 minutes, and don't forget to tell someone you love them today, including yourself. Remember that healthy mind, healthy body creates a healthy life. Till next time, stay healthy.